We are live now, doctor.
So, good evening, everyone. Uh, I I welcome you all to this MOS-YOSI webinar, which is series episode 4 webinar, where we are going to discuss handling HR issues in ophthalmic practice. So, I now invite Dr. Anaga Hirur, MOS President, to say a few opening words. Over to you, ma'am, for your comments.
Yeah, thank you, Dr. Aarti. Very warm welcome to one and all to this very unique webinar. So, usually we are used to looking at and listening to academic webinars, right? But today this is going to be completely different because we are not just clinicians, but we are also administrators, and we also need to be very well equipped into how we manage our clinics, especially the HR issues. Whether it's somebody who is just beginning or somebody who is almost 5 to 10 years into practice, these kind of problems keep cropping up. And let us all together today sit down and discuss threadbare as to how we can manage these issues and discuss and share our experiences. So, with that thought, we decided on this topic, and we are very happy and we are fortunate that we have excellent speakers and very experienced panelists with us today. So let's make the most of it, and I'm sure all of us will benefit from it. So let's dive into the webinar right away.
Thank you so much, ma'am, for those motivating words. We have with us Dr. Divakant Mishra, who is President of Young Ophthalmologist Society of India.
Thank you so much, Dr. Aarti, and very glad to be part of this again. As I said before, also we are very thankful to ma'am and the whole Maharashtra Ophthalmic Society for this collaboration and such pertinent and important topics which are usually not talked about. So let's dive deep into this, and very excited to be part of this again. Thank you so much.
Yes. So we have with us Dr. Nilesh Kumar, who is Secretary of Young Ophthalmologist Society of India. Dr. Nilesh? Okay, he says the audio is not working. So let's move on to our next section. So I'll invite Dr. Sunandini Bose to take the session forward. She is going to moderate the session along with me. Over to you, Dr. Bose.
Thank you so much, ma'am. So with this, we like to invite our esteemed panelist with us, Dr. D. Ramamurthy, sir. He is currently the chairperson for Eye Foundation India. Dr. Gaurav Luthra, sir. He is currently the director of the Drishti Eye Institute, Dehradun. Dr. Mandar sir, who is currently the director of Paranjape Eye Hospital in Pune. Dr. Manish sir, he is currently in the Department of Vitreoretina, UVA and Neuro-Ophthalmology at Dr. Bhapere Eye Hospital, Nasik. Dr. Vibhuti Kashyap, who is currently in Kashyap Memorial Eye Hospital, Ranchi, and Dr. Aditya Varman, who is currently the MD of Uma Eye Clinic, Chennai. And I invite Dr. Aarti ma'am, who is currently a consultant at National Institute of Ophthalmology in Pune, and she is the moderator of the session along with me. Welcome you all. So with this, I think we can go for the first talk by Dr. Isha Agarwala. She is currently the consultant and managing director for Rahi Netradam and Drishti Eye Hospital, Dehradun. Dr. Isha, can you share your screen? Dr. Isha, are you there? Yeah, okay.
Yes, ma'am. I'm just sharing my screen.
Yes, yes.
Yeah. Is my screen visible?
It is visible and you're audible.
Yeah.
You are good to start.
Yeah. So a very good evening to everyone present. At the very outset, I would like to thank Dr. Sunandini for inviting me for this, and a very good evening to the experienced panelists and all the members of the UC and MOS Society. So I would be speaking on the hiring lens with my very, very limited knowledge on hiring optometrist and ophthalmic assistant for long-term success. So So the problem that we face in most of the eye organizations are why hiring is the same protocols, but they have a very different outcomes because it is the people who make the most of the difference. And the reality check comes in when we have an extremely high OPD and OT, but without the right team, we have a lot of burnouts and complaints from both the staff and the patients. So it is then where we realize that the technology does not really fail the hospital, but it is the people who fail the hospital. So while hiring, the technical skills which almost all the optometrist and OT staff that everybody would have is how to do a diffraction, how to run an autorefractometer, how to do a vision testing, how are the OT protocols set. But the missing piece would be skills that matter more, which would be empathy, behavior, and stress handling. So the soft skills that predict the success of the team are handling children, elderly, and vulnerable patients, staying calm in an extremely crowded and emergency OPD, respect for hierarchy, accepting correction, and having a very ethical mindset. So the resume red flags that we can look for are frequent job hopping, a candidate having frequent job hopping in a year, like say having changed a job 2 to 3 times in a year, long unexplained gaps in a resume, no patient-facing roles as mentioned in a resume. In a resume, the candidate would have mentioned work independently everywhere, and he or she would have no respect for the previous organization. So instead of asking in an interview the very basic questions like what is vision, what is the principle under which an AR would work, what would be the sterilization protocols, we can ask these things like, tell me how would you handle a difficult patient? What if a doctor corrects you publicly? How would you respond to that? How would you handle an angry patient? What are the mistakes that you think you've made before, in your previous job? So in asking these questions would give us an idea that how is the behavior of the candidate. We can always observe the way the candidate would dress. And many a times the interviews that we take offline or online fail because many a times they would be at their best behavior. And this is why the trial days in a lot of organizations always help. So in a trial day we would have a short term observation, and he or she would take no independent patient decisions but would only be involved in a supervised role. And what can we exactly observe there is patient interaction, tone and behavior of the candidate, team behavior, obviously what are the protocols he or she is already for, clear idea to us how the candidate would be performing. So the brownie points that we can always look for before hiring is, if we get a referral from a known person, like from a friend or from a colleague, having a very good letter of recommendation, and if we hire from a very predictable source. So, I would like to conclude by saying whenever we hire any candidate, especially paramedical staff, optometrist, or ophthalmic assistants, we can look for three things in the hiring lens. One would be the skill set, can they do the job? Number two would be the culture lens, will they fit into the culture? And number three would be the ethical lens, can I trust them? So, the goal of any organization should be retention, continuous training, and development. And we should always and always have some long term vision for our team, like we have a long term vision for ourselves, like giving a handsome incentive for a star performer once a year. Or suppose if the hospital makes really good profits, by the end of 3 years, we can give a car or a scooty to a star employee. So that's how, that way the team would be motivated that our employer is a far-sighted person, and he or she is really involved, I mean, really interested in looking forward to our growth as well. And I would like to conclude by saying we must hire slow, train well, and retain forever. Thank you.
Thank you so much, Dr. Isha, for that eye-opening talk. I now invite Dr. Neha Deshpande. She is director at KGDM Eye Hospital, Nagpur. She is going to talk to us about Beyond the Paycheck. Over to you, Dr. Neha, for your presentation.
So at the outset, I would like to thank. So I'm Dr. Neha Deshpande, and I'll be speaking about Beyond the Paycheck. And at the outset only, I would like to thank YOSI as well as MOS for giving me this opportunity to do. This is a very close to my heart because our hospital. And when Anaga madam approached me with this topic, actually I was reading this survey, which said that 86% of Indian professionals, of course, these professionals consist of majority manufacturing and IT side, but they're still considering job change despite receiving salary hikes. And that is telling us something important, that only giving paychecks or only giving financial compensations, that's not enough. So this is going to be my agenda. So first, most of the questions which were asked during before this webinar were about bad behavior of the employee and why do they occur. Bad behaviors are very simple. They can be keep on complaining, not doing their work, doing gossip rather than their work, mobile surfing, making all types of excuses for not doing some work which was given to them. So these are called as disengaged employees, the employees which are not interested in what is actually their work and how to prevent that. And for that, there is a beautiful article, rather it's a book which is called as Herzberg Factor. Herzberg says that always a hospital, now I'm not going to talk about company, I'll talk about hospital. Hospital have to provide some hygiene factors. These are job security, compensation, which is at par with the market, good interpersonal relationship, and good physical working environment. But beyond that, you also should have some motivational factors. And these motivators are recognition, personal growth, responsibility, giving them more and more responsibility, advancement in their work profile, and work should be itself should be very happy. So if you plot 2x2s, you will, of course, we are not going to talk where hygiene factors are low. We are going to talk which hygiene factors are high, but motivational factors are low. The employee will be content but uninspired. But if both are high, then they will be, I'm very sorry, very sorry. Where is my sharing screen? I'm very sorry. So whenever they are uninspired, then problem occurs is that either they will leave because they are so much uninspired, or they will not do their work properly. And they will do their work properly if both hygiene factors and motivational factors are high. I'm going to give you some examples at every places. So my first example is going to be here, which is how important it is, how motivation is important. We also have a cardiac surgery unit in our another hospital, and there the 3 people joined. One and 3 people left. Initially, we thought for just 5,000 rupees rise in their payment. But later on, after meeting one of them just 1 year ago, I realized it was not just for money. It was more for position. They left for us because one of them was employed as a head of ICU. One of them was employed as a critical care inventory manager. So they were getting better, rather than better pay, they were getting better position, better decision making abilities. And that's why they left. Some employees leave, of course, for, of course, growth. But there are other reasons also for leaving. And they are insults, not treating them very well, not considering their growth as a growth of the hospital. If the employee is very intelligent, boredom can be one reason. And for ladies, safety issues and family problems. Then what is employee engagement? Employee engagement, this is a scale which is been taught by you. If you ask any HR, they will know this. We are not going to talk about these two because they are absolutely disengaged people. They will leave anytime. But these people, those who are focused, they are very highly engaged. They can be really, really helpful asset to the hospital. A simple example I'll give. I have a very highly engaged employee. I had some issue and for which I was not there in a very busy OPD for almost 45 minutes. She was the one who, out of her, nobody told her, but she just did some lemonade, distributed it. And while distributing, she just uttered one word. This never happens regularly, but yes, it must be important. And that actually kept all the patients still waiting. Nobody gave us bad star on the Google rating. And this can be done by a very well engaged employee. They can be helpful in your hospital growth. So what are the compensations? What are the monetary compensations and what are the non-monetary compensations? So monetary compensations, everybody knows because they're straightforward, simple. Bonus, commission, salary hikes, profit sharing. ESOPs are nothing but many companies who have either IPOs or they float their internal shares and then they tell about the buyback scheme. If the person is leaving, then they have a buyback option depending upon the valuation of the company. And of course, the retirement benefits. I told you, they are very, very direct and short way of satisfaction, but they are never linked to the hospital performances. And system needs to be transparent. If the transparency, they feel the transparency is not there, rather than encouraging them, it will actually deter them from doing any work. Then comes the non-monetary compensations. These are reward, recognition, some fun trips, sports event, flexibility of hours. Another example. Now, I have been brought up in Pune and Mumbai, and I shifted to Nagpur, where today only patient who was called at 8 o'clock came at 9:30 and said, "Ki, I'm on time." So this is the Indian stretchable time standards here. And when I came, I made it compulsory for all my staff to come within 10 minutes of their duty hours. They came to me and said, "Madam, 10 minutes is little too strict. Just be lenient about it." So what I did was that my timing, I kept it the same, 9 o'clock, but duty hours were changed. All the now they have to report by 8:30. So they at least come before me and the OT is ready before I come. Then employee development, mentorship, courses, sabbaticals that have to be given. Health, safety, and wellness of employee and family. Like many of our families might have a mother who might need a cataract surgery that can be done at a very subsidized level. They're happy about it. So now what study says about the monetary compensation? These are the 5 most commonly given monetary compensations. But non-monetary compensations are also becoming very important. Like for example, if you don't offer flexible working hours, 47% might think about shifting. Learning development opportunities not given, 67% will leave. Another important is meaningful peer recognition. All the terms are important. Meaningful peer recognition. So it has to be peer driven, frequent, clearly connected to performance. It should not be dictated by someone who is sitting at the top and he's my favorite, he's not my favorite. No. So it has to be peer driven. And of course, genuine paid off time. Taking paid leaves, not calling them for work on a leave day. It's very important. Now, is there any generational perspective for compensation? This is a very important question we all have to answer because we have different levels of employees, different ages of employees. So yes, definitely there is generational perspective to compensation also. So first is Gen X. They are the people who can get engaged with you 100% and give your their heart and soul. So they have immense experience also, but only issue is that they are the people who will resist change like anything. In such patient, we can reward them for their experience, give them job security, maybe change their job profile if they are not ready to change. Like for example, I had a employee who is with us for more than my age. So actually, she's very old employee, but she refused to do the changes which when I came in the OT. She said, "No, madam, I cannot assist you." So I said, "Okay." At that time, we were even thinking about NABH accreditation. So I said, "Okay, now you use your experience and manage all the paperwork, manage all the protocols in the OT." She was very happy. I was very happy. But let me tell you, she is the one who will wait without telling her. Patient is admitted 4 o'clock onwards. Her duty gets over by 4 o'clock. She will wait even till 7 o'clock till I discharge the patient. So that's why their engagement becomes very, very vital. Now comes millennials, us. Now let me tell you, they are very rapid shifters. They only love themselves. So their growth opportunities are only important for them. They are not the people who will say, "Arey, mere hospital ye hai, mera hospital wo hai." No, they will not. But they are strong team players also. And therefore, you can offer them either competitive compensation or learning opportunities. Then comes the Gen Z. No, very few I have handled up till now, but they have an entrepreneurial mindset. I had one receptionist who had the stupidest idea, but they worked in our OPD to make it more smooth. They have very short attention span. They can be very individualistic. They don't like to work in team. But very, very important is that if their work aligns, their values align with your hospital values, they are the one they can also be engaged like Gen X. Then comes, is there any method of deployment of any compensation? Do you have to give compensations every time, or can we give compensation at limited period of time also? Both can be done. So those where we can easily measure how much profit we are making, they can be kept as a compensations, maybe monetary, maybe non-monetary, throughout the year. Say conversion rates, optical, pharmacy sales, everyday targets. But if you're thinking about some change management, if you're thinking about you want to reduce OPD waiting hour, you want to reduce discharge time, you want to reduce infection rate in your OT, so you can do a change management with temporary compensations in that order. We can discuss this later on also. When we apply anything, when we apply any change measure, any employment increasing satisfaction or employment engagement drive, you should always measure. So how to measure? If you can't measure it, you cannot understand whether you have improved or not. So employee satisfaction have to be done by HR. Almost we do it every 8 yearly. It can reduce absenteeism. It can decrease your employee turnover. They will not leave you. Direct profit may increase by 20%. There will be direct impact on activities which actually will deteriorate your quality, like infections, by 45%. Our patients are complex, so patient satisfaction rates, which this study which has shown, it will only increase by 10%. Increase patient footfall, these are all indirect one. Increase patient footfall, increase your top line, increase your bottom line, increase footfall for even interviews for your employees, because they will talk among themselves that this hospital is very good to work with. Now, last slide, how an engaged workplace will look like. First and foremost, every person knows what he must do, what he can do, what he must not do, and what is the punishment if they do something which is must not. Like for example, if your must not includes no money issues, then that has to be defined. And if they get it, then their punishment also should be very well defined. Provision and permission to use instruments for their work. Like for example, if you have some costly instruments, don't make only one person responsible for it. If you want to reduce the waiting time, train everyone and then allow everyone to handle, or train 2 or 3 people and allow those 2 or 3 people to handle them. Then monthly or 2 monthly review, where you can praise for good and softly tell about problem, but never discuss problems in front of patients. That is not something which is liked by many of our employees. Sending them to courses which are sponsored by hospitals. Many times you can take a legal binding also that you have to work after this course with us for 2 years. Upgrade their job description, regular lectures by doctors. That also, actually, they feel that I have been involved in my patient care. Always have personal touch as much as possible. I know after a certain limit, the personal touch goes away, but still try to, celebrate small wins. Try to have a get together so that, you have an interaction with the staff. Always have. In our hospital, we have a least turnover rate. We never, give monetary compensations for personal achievements. We give it for team achievements. And personal achievements, for that, you can do some small celebration or recognition. So thank you for your patient listening. I think I might have been helpful in this webinar.
Thank you so much, Dr. Neha. I must say that you are really passionate about this topic. Your presentation was a real eye-opener. There were so many very, very small points which you discussed and emphasized, and I'm sure all of us are going to get benefit by that. So let's move on to the another talk, which is a special talk on handling employee in stress. And I invite Miss Anu Sharma for this talk, who is a clinical counselor. Miss Anu, can you please switch on your video and so that we can see you?
Hi everybody, good evening.
Good evening.
Am I audible?
You are audible.
Yeah, thank you Aarti for introducing me in the meeting member. I am very happy to present my topic today. It's an honor to present my topic in yours. So may I share my screen if you're
Yes, please.
okay, thank you. Okay, so let's talk about how we can handle our
We
stress.
cannot see your screen yet.
Okay, just a second. I'm so sorry.
Till the time we are fixing this issue, any of the panelists would like to comment on the talk so far? Anaga ma'am, you're there? Gaurav sir is there. Over to you, sir, for your comments.
Hi, Dr. Aarti. I think both talks were excellent and a lot of good information there and very nicely put across. So I would, in fact, I learned a few things from the previous talk. There were so many nice things which you already know, but for somebody to put them across in a more organized way is always very welcome. And I'm sure that whoever would have heard through this will be able to implement some things almost immediately to improve upon how they are able to relate to their employees. So obviously there is no end to what we can do, but I think these are all baby steps, which not even baby, these are all very critical steps which can help us get there. So a few things stood out. For example, I really appreciated the fact that different generations behave in different ways. So the Gen Z and the previous generation and the younger generation, because we do notice that times have changed so much that things are going, like each generation has to be handled differently. But I think we're already ready with the next presentation. So let's go ahead and we can always talk after that.
Yes, sir. So, Miss Anu, can you put your presentation on a slideshow mode and then we are good to start?
Yes, thank you, Aarti. I'm very sorry for the delay. Okay, so is my presentation visible to you guys?
We are just waiting for it to be on the slideshow mode. Yes, we are good to start, please.
Okay, thank you so much. Sorry for the delay. So let's talk about handling the stress in a employee setting, okay, in a working place. Okay. So the thing is ki first thing why we are talking about this thing is ki every surgeon or every doctor face a major issues ki our working life is very stressful and we have a high patient role and we are very having a long duration surgery hours also, which leads us to very stressful situation. And we have a very surgical point, we have very many minor surgeries we face and we need to have a very focused and very relief and relaxed mode. And when we are stressed out, we feel like we are not able to put our 100% and our potential is very low in surgical, and which impacts our patient and our career and our entire staff members or our entire team also affect the same thing only. So I feel like every doctor has to have a less stressful situation, and we should know how we can help ourselves to reduce our stress, because when we are able to help ourselves, we will be leading us to which will be leading us to help our staff members also, our team members also in the surgical area. Okay, so one thing, when we are stressed out, we increase our tendency of errors in our life. Okay, we increase the we increase patient satisfaction is reduced, and from our surgeries our productivity is also reduced. We will be impacting as a doctor. We lack back, we are not satisfied with our surgeries also, which leads us to less, which lead us to low self esteem also. So which that is the reason because we I am presenting today the topic of stress, because as a person I also feel like sometimes we are stressed. As a psychologist we are also sometimes stressed, but why, how we help ourselves to help others also. I feel like I should share this topic with you guys also, because as a psychologist we help ourselves, so you might be also be helping yourself and your staff members also. So the second topic I can be going with key, what is the major thing why we need to understand the stress situations, that why we are stressed out, why we need to be focused enough. When we are in a micro surgeries and we are facing very difficulties in our life, so it impacts our professional growth. Okay, and when we have to go with a surgery which is very minor and very micro surgeries, we need to be very focused, we need to be having a very good motor skills also, because we have a when we have are in a stress, our motor skills impact, and when our motor skills impact, our surgical performance also impacts. So that is the major reason ki when our motor skills are impact, our surgery is not good enough, and our training, or as a professional or as a tutor also, or as a training expert, or like we are training our juniors also, so we lag back, and as a idol, as a senior, we are not giving our best to them also, and we are not creating good doctors also. So we need to learn how we can manage our stress, so that the juniors who are learning from us, our staff members, our team also, they should learn ki how we can, they can be at our place in coming of years also, how they can be uh, managing their stress, and they can be also learning ki how we are controlling our stress, how we can help ourselves. So we can be going with ki I will be telling this topic, I will be going with be telling you few techniques which can help you guys to reduce your stress level when you are in a peak of overload with the burden, overloaded with your number of hours of surgeries also, and you are overloaded with the work pressure also, and how you can lead with your team members also, how they can help themselves, and how you can identify ki, is your team member stressed or not stressed. So psychologically we can go with ki how stress impacts our productive, how stress impacts our personal life also and emotional life also, behavioral, physical, biological, every way. So when we are in a stressful situation, initial stress starts with the minor stress points, and it which leads to the chronic stress. After your chronic stress are developed, you will be having a irritability, you will be having insomnia, you will be having a fatigue situation, you will be feeling restless also. So in this situation we are not giving our 100% in every of our task, and we lag back also. We will be not able to perform a small minor things also, we will not able to focus, we will be having a lack of concentration in our day to day task also. And this all compact with leads us to low motivation, it will lead us to a burnout state also. Emotionally we will be burnout, exhaust we will be feeling emotionally also, and we will be having a symptoms of anxiety, and maybe lead us to the depressive state also. Because as a professional we need to go with ki I have to do my best, I have to perform my best, I have to be a best surgeon also. These dreams and these minor things impacts our every future point also, every future step also, when we are stressed and we are ignoring it day by day. So I personally feel like ki when you are stressed, don't ignore it, just share it with your colleagues, just share it with your team members, they share it with your seniors also, so that they can understand and they can something create or do, so that you are able to collect yourself, collect your thoughts also, and make your productive increase also. Next come ki how you can identify ki are you stressed out or not, are your colleagues stressed out or not. So there are some symptoms which we can observe also in our day to day task. We can identify also ki yeah, this is this person or this my staff member or my colleague is stressed or not stressed. When they are coming with the emotional stress, you will be seeing irritability, they will be arguing on the small talks, they will be having a withdrawal symptoms also, they will be having crying spells also, they will be talking mouth to a person also about you, they will be sometimes they will be feeling like bitching also. So these are the emotional symptoms. When person is stressed out, they need to go with external fact, instead of sharing their personal stress, they will be sharing external factors points, which they feel like ki, this is relaxing me, but it creates more chaos between the staff members also. Coming on, the next point is behavioral science. They will be making mistakes, they will be having conflicts with colleagues also, they will be feeling, physical science might be they will be feeling headaches, fatigue, and they will be having they will be applying for the sick leaves also, because they're exhausted emotionally also, behaviorally also, and physically also. In this situation, we can do what we can do as a senior or as a good doctor or as a good colleague to our staff is very important. And so I will be leading, which will be leading us to how we can help our staff members handling their stressors. Instead of the common mistake which I have seen as a professional psychologist, which even we as a professional I also use with my employees also, my juniors also, instead of pointing out their mistake, ki, you did this wrong, you are being careless today, you were not focused today, instead of saying this thing or asking this or blaming them, just go and ask, are you well, is everything okay, are you okay today, are you feeling well, do you need me to help you out? Ask them. Whenever you will ask your employer or colleague a single thing in any day, they will be feeling like, yeah, yes, my boss or my senior is, or my colleagues are good, I am very relieved, at least they are asking me ki how I am feeling, my feelings also matter, apart from my work, my performance, my feelings are also mattered in my working place. They will feel like ki, after my home I can be trusting my environment as a home only, because I feel like, and I always used to say to my colleagues also, ki, your working place is a place where you spend more than your number of hours than your home hours. So it's like ki, you have a second home in your working place, and you should be very connected to your colleague as a team member, as a family also. But it comes ki, sometimes it like sounds wrong ki you cannot share a family environment with your colleagues, it's a professional setting. But you can be sharing a family environment like a professional also, na? There is no boundaries ki you have to create some certain limits, you can focus in that way. But asking your colleague is also good ki you are emotionally your their feelings matter to you also, and their performance also leads us, because if they are stressed out, their performance will reduce, and your productivity, your clinic productivity, everything will be impact, vice versa. So I feel like we should ask every employee how they feel like. How can we help them to train if every meeting ki if everybody is stressed, like my entire team is stressed because of the workload, so what can I do? Which I used to do is like ki I tell them to relax themselves with the small activities or techniques. So here is the first technique which we can use to stress ourselves, to overcome from our stressors, and we are overloaded that time. Okay, so first technique is like ki we have to go with 4-7-8 breathing technique. Why is it called as 4-7-8? Is like you have to inhale for 4 seconds, then you have to hold for 4 seconds your breath, and then you have to exhale it. When you are doing this thing, so your breathing is not done by your lungs part, it is done by abdominal area. Okay, when we breathe from our abdominal area, our blood circulation is done properly. Okay, and when blood circulation is done properly, our heart rates gets relaxed, our heart rate gets reduced from a pumping higher rate, it gets calmed down situation. Okay, so this is the best technique which I also personally use it, and I feel like it is very effective in a major stressors, and when you are exhausted. Second technique is ki when you feel like ki, after a surgery we are exhausted, and we feel like ki our face gets hot flushes also, parallels also. So at that time you can wash your hands with the wrist for 30 seconds with a cold water, or you can use it ki sometimes people say ki why to waste the water in that situation, and why to go with washing our hands for every time in 30 seconds if I am stressed out in a day. So you can go with ki just take a napkin or a tissue paper, soak it into a cold water, and apply it on your face or your wrist area. Or you can use it a towel also, cotton towel, and just wrap it on your wrist area. It will help you to reduce your facial stressor situation, and it will help you to calm yourself also. Third step is ki when this third one technique is very effective in a surgical areas where every doctor used to do surgery. You can go with the shoulder relaxation technique, where these points, as you can see in the ppt, there are some points, certain points from where the body gets relief and stressed, your stress has been reduced, because these areas impact your high motor skills, they will help you to stress out, get relief from your higher stress also, and it will impact your improving your motor skills also. So when you are relaxed, it will help you to calm down, it will help you to perform best next coming to 20 to 30 minutes more effectively. You will be having a relief state. Okay, coming up to the next technique is like you can go with a grounding technique also. It is like ki 5 4 3 2 1. Okay, 5 stands for ki you have to see 5 things which you can focus and you can feel like ki, ha, this is making me focused in some other direction apart from a stressful situation. Okay, 4 stands for like you have to hear something, 4 different sounds, and you have to take your focus according to the 4 sounds. When you are taking your focus to accurate 4 sounds, you are just getting diverted from a major stress, and your focus is diverted to the 4 sounds. Now you are focusing on your like yeah, like you can hear a fan sound, something audio, your cell phone messages sound also. So go with different 4 sounds and hear it. So next come is like 3. You have to touch the 3 things where you can feel the thing. Like you can touch your cell phone, you can touch your water, or you can touch your glass of a water. Sorry, you can touch your glass of a water. You can touch something, your pen and object. So you are focusing on 3 things. Then you are smelling or touching the thing. Okay, you have to touch any 2 things which you feel like comfortable or comfy. You can touch your clothes, you can touch your rest area or anything, or you can feel yourself also. One is like you have to smell something which makes you feel at that moment you are focusing ki, ha, what is the fragrance I am feeling, is my room has my my nearby my appearance, I am able to inhale. Focus on that thing. This will help you to reduce your stress level, because it will lead you to disconnect from a major stress, and you will be distracted for a few seconds. Then when you are focusing on your major stress again, you will be having a wider perspective, and you will be focusing on major compact. Third thing, which is the best technique I used to go with, ki heart rate technique. It's like you have to connect with your heart, and you have to feel your heart and your rhythms also. So if you are going with these techniques, it will help you to reduce your stressors, and you can have a next 20 or 30 minutes in your life with the after the surgery in a very reduced way. Red flags which we can see if we are very stressed, and we can be agar hum if we are avoiding our stressors, then we can be facing in our life. So if you are ignoring your stressors, might be having a consequences or tendencies or chances to face some psychological or clinical disorders also, which may be leading to the insomnia, chronic stress, chronic irritability, emotional withdrawal you will be facing. You may be having loss of interest in your professional life. You will maybe having a loss of interest in your hobbies also, might be. So these might lead to you having a disconnecting with your professional areas also, because stress can create anything, and you will be facing any such scenarios out of these red flags. One thing which I feel like should every doctor should every doctor feel like that we doctors are strong. They will be they will not be facing stressors. Even as a psychologist, I also heard from my few patients कि मैम आपको तो स्ट्रेस क्यों ही होगा, आप लोग तो साइकोलॉजिस्ट हो, मैम आपको तो डिप्रेशन भी नहीं होता है. बट द रियलिटी इज कि even if we are a professional, we might be having a scenarios in our certain life कि we are also stressed, but we use it our techniques in our way also, and we also seek to a professional help also, because I feel like no one is perfect in their life, and sometimes your imperfection is also good in your life, because your imperfection makes you more beautiful and makes you more good enough to grow. And when you are accepting your mistakes, it's easy to connect with the people, and they will also learn from you ki, ha, accepting our mistake is not bad, and sharing our concept is not bad enough, or sharing our pain is not bad, and this will not give us a stigma, or this will not give us a judgment from a society. at last I will like to conclude like I feel like when as a doctor or as a mental health professional or as a surgeon, any medical facility, if we as a professional touch any single life, we don't touch a one life, we touch every life that life touches. So it's like if you are helping one person, you are not helping that particular person, you are not helping his life or her life, you are helping the entire family or the life with the person is connected with. So I feel like this is very important for us ki if we are helping them, so we should help in a 100% productivity. We should first seek ourselves to a help. If we are healthy and we are mentally and physically present in our present state, it will lead us to higher productivity, and we can help in our scenarios very nicely with the society also. Thank you.
Thank you so much, Anu Sharma. I think it was very enlightening to hear a psychologist talk about, how to relieve your stress in day-to-day life. And I'm very sure that we have also learned a lot that how to relieve our stress and not only the staff stress. So I think with all the talks done, we can now go to the panel discussion. And we had done
Thank you,
a
Sundari
uh,
ma'am.
Thank you. So we had done a practice pattern poll where we have got some questions from our ophthalmologist friends, and we are going to discuss these questions with our panelists. So the first question that we have got is how the incentive, bonus, and the increment should be structured. So my question is to Dr. Gaurav Luthra sir and Dr. D. Raman sir. Sir, over to you.
I'll let Dr. Ramamurthy go first. He's the master, So
Um, so I think it's very important to uh, have a definite growth path for all these people. And how we do it is whenever a person joins initially is on a fixed income. At that time itself, they are given an idea that over time their performance linked bonuses will also be there, and it's already built in. Supposing I'm taking somebody for 2 lakhs, 1,50,000 is salary and 50,000 is bonus.
I can't hear Sir Sunandini.
Yes, yes,
Is it
yes,
my
yes. I think
network?
there's some lag.
Initial 3 months, 6 months, he or she gets the component of stays as 50,000. It is with this, and then I can chip in.
So
Gaurav?
your voice is cracking, sir, probably because of a poor connection. Yeah, we could make out, but it was not very clear.
Hello?
better.
No, I'll just be reaching home. No, I'll be just reaching home. Gaurav, can you just take that question?
Okay. I think Sir says that
Sorry,
he was
Gaurav, can
probably
you
going to
take
reach
that
home in a
question?
while, then he'll
Yeah.
be able to answer it. So the question was that how do you handle incentives and bonuses? Now it depends on whether we are talking about clinical staff and paramedical staff and other staff and doctors as well. So essentially, while what we've come to understand now over the last few years of practice is like when I started off maybe 25 years back, these things were hardly relevant. But as we've gone through time now, they definitely make a difference in how people's motivation works. Most people just take their salaries for granted, and they're basically working for the bonuses and incentives that they might want. And some people are actually so upfront that at the time of hiring they immediately come up. So first thing is I'm very wary of people who make that as their most important point when they're joining the organization. We do have now policies for certain incentives and bonuses. I also like the fact that when Dr. Neha was mentioning about when you reward the team rather than the individual with financial incentives, it always works better. Otherwise, you tend to have infighting amongst people, and then in the same team, people will be trying to undermine the other one or the third one. So it helps to have a team incentive rather than direct incentives. Yet, in certain situations, it also helps to have direct incentives, because that motivates. Some people are like much better performers than others, and they tend to kind of so you have to individualize it. There cannot be a fixed rule for that. Again, when we also talk about hiring consultants and doctors and other team members who are senior positions, there I think incentives have to come in only much later, because initially when we hire them, they usually are hired on a salary which is commensurate to their experience and all, but they are told that down the line, once things are settled and we are comfortable with the way you're working and all, incentives and bonuses can kick in, which they should, because otherwise the motivation may not be there. So essentially then there has to be a proper structure to it, so that people can understand that how, and then it should be followed. I have become aware sometimes of organizations where people come for interviews and they say that we were promised bonuses but we never got them, or we never got them on time, and they would come after 3 months. So if you're promised some kinds of incentives and bonuses, they must then be properly distributed, and in time they should be, because otherwise the person feels very let down, or kind of not comfortable about it. These are few thoughts, but I'm sure there are lots of more points on this, and if more come to my mind, I'll definitely share them.
Thank you so much, sir. Dr. Mandar, sir, your views about these questions, please.
Yeah, thank you for the opportunity, MOS and UC, and some good talks that we got to hear on a subject which is often not taken very seriously. I speak from the standpoint of a single standalone practice. It's a small practice. Mine is not the institute. So basically, I'm going to talk about the staff which helps you in your clinic in terms of the reception or the operation theater or some other paramedical staff. Well, actually, money does matter in many ways, but as Dr. Neha also said, that should not be the only factor, motivating factor. And I think it has to be tied to the performance of the person, and they need to be made aware by various ways. Like she said, either as team or even as individuals, and reward should be based on that. And of course, you need to have a schedule in place to decide when to revise the payment. So it can't be like somebody who walks in after 6 months of joining asking for a raise. So that policy should never be entertained. And also it should be linked to the way, suppose it's a front office staff or a reception staff, it should be in a way linked to the way they deal with the patients, because oftentimes and now we have monitoring by the CCTVs, you realize the way they behave with the patient, because that is the face of your hospital or clinic, and that matters a lot. And if they make mistakes, I think they need to be made aware of it. You may not penalize them for their mistakes, but I think they need to be made aware, and they need to be told that such mistakes are not accepted, given the kind of profession that we are in. But all in all, I think it is, as Dr. Gaurav also said, that it's more individual based, and it has to be linked to the quality of performance and the service that the person is going to deliver in your place.
Thank you so much, sir, for this insight. We have one more question, sir, that how much salary can be given in cash and how to do then the provident fund and the ESI adjustment from these people?
Yeah, so in our place, we give the salary, never give the salary by cash. It is always by NEFT transfer. And since our organization is a very small place, we don't have issues with Provident Fund. But because the number of persons is not crossing that threshold, but I'm sure there are more experienced people who can answer that query.
Thank you so much, sir. Gaurav, sir, your views about this
Yeah, so actually, once your organization is bigger than 10 people, you definitely have to move on to, compliances, and it's very important. And actually, labor compliances now mandate doing salary transfers, by to the bank accounts itself. In fact, to the extent that now all payments, including bonuses and everything, initially there was a time when bonuses were allowed to be given in cash. Now even that is not allowed in cash. So almost everything has to go by check. So that does throw up challenges, because that changes everything about your not only the compliances but also about gratuity and other things which creep in. And now with the new labor laws which are coming in, which are likely to get implemented this or next month itself, we will have that another thing coming up about eligibility for gratuity at 1 year itself, and even for those employees who are not just outsourced but also contractual employees. So frankly, you have to be very careful about this, and it doesn't make sense to actually cut corners here at all. And otherwise, it can land you up in big trouble. So I don't see any reason that a clean organization which is compliant with all the rules should be cutting corners on any of these things. And in a small setup which employs like very few people, cash salaries may be possible. But also it becomes very difficult to monitor cash once you have grown beyond a particular size, because then it can start becoming a liability as well. So that's my take on it. Yeah.
Thank you, sir. Also, I wanted to know, sir, like if we take people on contractual basis, so but does the labor law now says that we have to give them provident fund or ESI benefits because they will be anyways on contractual basis? So sometimes what happens that in our hospital when the ayas or the staff they cross a particular age and we do not we retired them from the hospital system, but then we put them in the contractual basis where we do not have
So
to.
we recently had a interaction with the labor this thing department, and we had a couple of employees who had retired. They had crossed the age of retirement, and then they were kind of re-employed on a contractual kind of a basis. So we were told that it does not work like that. They still have to be, and they can be kept under ESI and PF compliances as well, is my understanding. And you have to. You cannot say that because this person has crossed the age of retirement, so we've kind of put them on some kind of a fixed salary where the benefits are not going to accrue. And we had to actually move them back into the system. There were two employees whom we had re-employed after retirement. So I think that is mandatory. Even all your outsourced employees, for example, if you're outsourcing employees to housekeeping and your guards and other stuff, you have to actually ensure that not only is the organization who's providing that staff, also, you have to pay for the ESIPF compliances and everything. But you also, it's your liability to ensure that that ESIPF has actually been deposited in that person's name. So every month you have to actually take their ESIPF, compliance data and check that each of your staff has actually. Otherwise, that liability will come on you.
Yes, sir. Yes, sir. So we also take from our third party
From the
people.
providers. Yes.
Yes, sir. Yes, sir. Thank you so much, sir. Dr. Aarti ma'am, if you can take the next questions with
I
our
will.
panelists.
Yeah. So I think Ramamurthy sir is back with us. So I'll ask next question to you, sir. How to set proper salary structure for this staff when two different hospitals merge together with different salary structure for the staff?
That's a tough question, and a tough problem to deal with. Obviously, you cannot bring down the salaries of the uh, people who are getting higher salaries. So basically, you have to merge them both, but at the same time, see to it that you raise the salaries of those who are on a lower pay to a higher levels. Maybe this can be performance linked. Obviously, the center where they are getting higher salaries, it might be based upon the performance of the entire center as a whole. And when you are integrating a smaller center into a bigger center, which sometimes does happen, it's one thing is it's not necessary. It's our policy also. Generally, it's not necessary that every employee should know the salary of the other person. It's something that is supposed to kept in their mind and not to be revealed or not to be discussed. This is often said, but this doesn't happen practically. So oftentimes you have to do a balancing act, and the transition is sometimes painful. Sometimes you might have to even let go of some employees who are not performing. But in case you find that in the case of some employees who are in this lowest salary bracket, but they are contributing very well, it will pay for you to raise and bring them up to a higher level, and finally the organization does benefit. My simple answer to this would be that you have to see to it that you retain the best of employees, and over time, at least all of them are who are at the same level of same grade of employment are given equitable salaries.
So let's hear voice of our young ophthalmologist. We have with us Dr. Kashyap and Dr. Varman. Dr. Kashyap, we would like to hear your views on this.
Hi, good evening, everyone. I sort of agree with Ramamurthy sir on this, but as far as our, if say we tend to merge with some hospital, this was your question, right? When you have two different hospitals merging together, so we tend to set the salary to the salary that whichever one is higher. Say if I'm merging our ophthal department with some ophthal department of some super specialty which are paying them a bit higher than what we are paying, then we have to, and that is a bit of a pain, but that is when we take the better pill. We shift the salary to the higher package, so that I mean it is a win-win for both the parties. The parties we are taking over from, they are not dissatisfied with the new recruiters and the new management, as well as the older people whosoever are within the team, they get a salary hike. So that is the way we find it is. The transition is much smoother with less amount of friction, because there's always some personality friction as well as the management friction that goes on within the employees of the older employees hired by the older management with the newer management that takes over. So our mantra is you shift the salary to the higher one, whichever is higher.
Dr. Aditya, your views? Looks like his video is freezed. I really can't see him moving. So we'll move on to the next question. Uh, how to get good quality and sincere staff, or let's say how to develop sincerity in staff. So this is our next question. Gaurav sir, would you like to give your insights for this?
Yeah, that's a very important but a tough one. Essentially, what happens is that when you're recruiting staff, that's the time when you actually look for the traits, of sincerity, because you can make out. And I think Isha was talking about some of the traits that you should be looking for, when you are hiring. And essentially, that's the first step where you see that you hire the right kind of people who are sincere and who appear to be sincere at least. And you can generally make out from a personality kind of check who is going to be what. But then essentially, once people join in, it's important to again reward sincerity, because that always helps. So if you have staff who are sincere, like we have a monthly kind of thing, small get together for all the staff, and we reward people for their traits. For example, those who are very patient friendly will probably get some kind of a small certificate of recognition. Those who are having good punctuality, those are better groomed. Those who are kind of having giving a better ownership experience, and who are kind of sincere to the organization. So for different things, we typically recognize people for their traits. And frankly, another thing that I do feel is that staff tends to follow what examples you set. Typically, that's something which works all the time. So if you are leading by example, and your doctors are leading by example, typically the staff will learn the same thing. So if you are kind of rude to your patients sometimes, or you quip on them, or they will kind of, it translates to that. So I think that's another thing that we can do is to lead by example. And of course, now I also feel that constant reminders and constant training and constant it's like feeding it into the system and giving them that thing that these are your key traits which we look for in you, and reminding them in a gentle way, in some different ways. These are some of the things that would work, and then I would love to hear more from others. Yeah.
So Dr. Neha, let's hear your views on this.
No, it's always from top. It is top to bottom. It is called as top bottom approach. So if there is sincerity, then definitely it will percolate down. Still, if a person who was not there were examples in our hospital also. Very sincere lady suddenly started behaving very oddly. In that situation, you have to have one-to-one talks. There is nothing you this cannot be helped. And in that also, I was the one who to be blamed. She said, "Madam, you scream too much." After that, you and doctor need to improve at every place as a leader. Very importantly, leader has to accept, yes, this was my mistake. Now I'll not do again. And after that, I have really, now I feel I'm a much more calmer person myself. Thanks to that person telling me, ma'am, you get angry very fast. So these things have to be done. You have to accept your mistakes and move on. And I think once they realize that, from top down, things are changing, things are being accepted, I don't think so. No, anybody will try to behave badly. Anyhow, it has to be open communication.
Communication, yeah, I agree. Dr. Aditray, are you able to talk now? Can you
Yeah,
unmute
sorry.
yourself?
Yeah. Sorry for that brief interruption in my
Yeah.
connection. Yeah, so
Yes.
I think
So
this is a
let's
very,
hear your view.
yeah, so it's a very interesting question. So I think within a couple of weeks, we can kind of identify which staff are more sincere and which person takes more effort and gives more into their work and has a sense of duty. So I think those people must be given a sense of entitlement. As in, if you see a person who's working harder, you can give them more responsibilities. For example, if I see a couple of optometrists in my team who are working exceptionally well, what I do is I promote them into a more premium optometrist, meaning they can refract for my patients who do refract, who I'm going to perform refractive surgery because I have very strict protocols for my optoms. So they get put up in another level. The other way that I encourage people is by trying to help them publish more work. If I see an optometrist who's doing exceptionally well, I encourage them to put in case reports in journals. This is just an example. So I think team members who take the initiative, who put in more effort into the work, not just financially, we must try to reward them. We must also try to reward them by giving them a little more of a pedestal, by giving them more responsibility and telling them, yes, now that you're working, this is the position that you're going to be in.
Thank you so much, Dr. Aditri. I think this is definitely very important that when you have a staff, when you want to get some staff with good sincerity, you have to, at some point you have to give that designation that, you will be doing this only and you will be doing this only. I think that is also very important. So moving on to the next question. So this is my favorite one. How to handle a senior staff who thinks that the hospital cannot run without them? So can you answer that, Dr. Aditri?
Okay, so I have a very cut and dry approach about this. So I think in our clinic, if there is any negativity, if there's any person who's bringing the team down, no matter how senior, we cut them out. That's that's as simple as that. We've had people who've been with us for 8 years, 9 years. They were very sincere in the work, but after a certain period of time, if they're bringing the rest of the team down, and we try to speak to them, we try to explain to them that this is now not how the way that the things are going to be. You still have specified roles, and if they still persist, we have to show them the door, show them the door. So I think we have to be very clear about that. You should not be afraid about losing such staff. Sometimes holding on to older staff that are not performing well and are dragging the team down will also bring down your work. So holding on to such people for nostalgia or fear of losing our old employees is something that we must let go of. We should be bold enough to take the decision, let go of that staff, and put in another person who is enthusiastic and sincere about that work to take up that role. Be very surprised that that section of your hospital actually functions better without the older staff.
Then I agree to this point 100%. So I would
I
like to
think
ask Dr.
giving them
Manish,
an
sir. Yes,
example,
sir.
giving them an example that, even we can work, that it is always said that graveyard is full of all the indispensable people. So this I keep on telling them, but most important thing, what I prefer is we shift them to some other duty and let the duty be performed better, and let that staff know that it is already been performed even without them. But they can come without troubling the others. If they can, then definitely you're welcome to the old team again. I think that can be done.
Agree to it, ma'am. Agree to it completely. Dr. Manish, sir, if
Mhm.
you're there, Dr. Manish, sir.
So Nandini, Dr. Manish's
Acha, okay,
Wi-Fi is not, yeah, connectivity
okay,
has got some issue, so he won't be able to join us.
okay. No issues, ma'am. Dr. Mandar, sir, your views about this question, please.
Yeah, before me, I think Ramurthy sir wanted to say something. So if you could just.
Yes, sir, please.
No, I think this is a very important question. It's always important for the organization to know that nobody is indispensable, in the sense that at the same time, I am not for a very harsh dealing with all the staff. You try to encourage them, mentor them, teach them, and retain them. That is the first mantra to success. But at the same time, if anybody thinks that he or she can get away underperforming, lording over others, and getting benefits which are not really due to them, it's definitely important to cut them down to size. Very recently happened to me in the sense one of our bigger centers where refractive surgery was very important. Almost for 15 years, one optometrist was performing very well in the beginning, but then started taking things for granted. And we felt that the numbers were coming down. It was not so good. But it just so happened that he had a personal reason for which he had to take off for almost 2 months. At that time, one youngster, another optometrist whom we had hardly noticed, came forward, took it up. We found that there was almost a 15% increase in numbers. So once this person came back, we just reshuffled the what responsibilities, and as was pointed out by one of the earlier speakers, made these youngsters perform and to take over this refractive surgery counseling. And since then, we have found that the whole department has started doing well. And that also sent a message across because this person had been around for a long time across the organization that these kind of steps can be taken. So oftentimes you come across these situations where people who have been around with you for a long time come with a sense of entitlement. Sense of ownership is always welcome, but sense of entitlement is not there. And as long as you identify people for how well they are performing, how well they are contributing to the organization, and how sincere they are, I think that should be the yardstick by which you measure them, but not by the number of years they spent with you.
I
Yeah, I
agree to
agree.
it.
Yeah,
Yes, yes.
agree to all that was said. My approach would be that in case such incidences do happen with senior staff, I think having a word with the staff, a quiet word as to what is the issue about, because oftentimes you realize that there could be something in the family of that person which is troubling them, or there could be some other matter which is troubling them and which is reflecting in the way they are behaving. Oftentimes it is quite difficult to cut off this staff because literally they have been working with you for a very long time. You sort of develop a relationship with them, and they sort of instinctively know what you need, or it's a very delicate balance that one needs to have. But as sir said, a sense of entitlement is definitely not encouraged, and I think that message has to go very clearly. And as was said earlier, in case after a certain period of time, after giving a notice, after explaining the behavior, if they still don't improve, then I think cutting them out of the organization is the best way to deal with such situations. Oftentimes, you can hire somebody to assist that person, sort of create a pressure, make them realize that even if they are not there, the work will still go on. So it is not that they should take things for granted. So that sense of competition, or that sort of it's a bad word to use, but it's like a sword hanging over their head, that they have to be careful about the way they behave. Just because they have been working in the organization for a long time doesn't mean that they can behave the way they want. So I think that is the way to deal with the situation.
I agree to it, sir, that an institute cannot suffer because of one single person. Definitely, sir. So, coming, yes,
Shall I
yes.
be?
Dr. Vibhuti,
Yes,
yeah,
sir.
Dr. Vibhuti want to comment on this. Sunil.
Yeah, I mean, Ramamurthy sir's and Mandar sir's inputs were highly right. I would just like to add one thing. I mean, I completely agree with sir's statement when he said sense of ownership is welcome, but sense of entitlement is not. But there's just one thing that I want to add. Sense of ownership also comes into the staff when we treat the staffs like our own, and it sets a very it doesn't give a very good taste of example when a senior staff is cut bluntly like that. So what we do in our setting is we also have a lot of old retained staff, so we always give them a benefit of the doubt, and we give them the extra edge of comfort and the extra edge of benefit of doubt, and we like to hear them out clearly and completely and thoroughly, in person, in private. And what that does is it also adds a sense of security and safety to our new staffs, wherein they think that being older in this institution does have its own perk of the employers listening to the older staffs more and giving them time and also the benefit of the doubt more than the younger ones is just not based on the results that they give. But of course, that shouldn't go overboard, but they should be feeling like they have an edge over the younger ones.
Thank
Well,
you
I
so much,
think,
Dr.
sorry for interrupting, but I think Vibhuti did bring up a very important point, and I don't, definitely my intention is not to be harsh towards my staff. And my personal thought is that, I take care of my staff and they take care of my patients. And it's extremely important that they have a sense of belonging, sense of security. And it's
Yes.
just only the bad wood that you're going to cut off. But otherwise, you always give them adequate chances. Anybody can get infrastructure, equipment, but your real value is the people around you, not just
Yes.
the consultants, but right up to your driver, up to your receptionist. And these long-standing employees who bring in great value to the organization. So obviously, you give them adequate chances, see whether they can adapt to the new situation, continue to contribute. And the last resort only would be to let them go.
Yes, sir.
Yes, sir, definitely, sir. So we move on to the next question that we have got. This is how to handle a maternity leave and the post-maternity retention in this stuff. And what happens when the person takes a longer maternity leave? How do we handle it then? Anaga ma'am, you have a lot of female staffs. We would love to hear your views about this.
Yeah, hello everyone. So, basically, whenever we have such a situation, we usually have to pay them for 6 months by law. So, and they should be made to feel secure about it. We have had staff who have been with us for the last, say, almost 10 years, 15 years, got married, then went through two maternity leaves, came back, and are still with us. And you need to just be with them at that time. So for 6 months, that payment needs to be done. You need to speak to them about it, and then they can join in initially like half day or so, and then they join in full for the whole duty timings. So that is how we usually do it. Of course, if more than 6 months is not really necessary, but by 6 months it is done. Many of them join in much earlier also, maybe 3 months or so.
Right. Thank you so much, ma'am. Dr. Nilesh, if you have any comments about this.
Actually, ma'am, my head desktop, the speaker was not working, and I missed most of the discussion actually. But I'll just go through YouTube and relearn all those things. Actually, I wanted to attend this webinar because I am constantly finding HR issues to happen in smaller places because these are not professional. Very hard to find any professional person in tier 2, tier 3 city where I am practicing. So just wanted to know about all the nitty-gritties that are there to handle that. So thank you everyone. I'll go through it, and then again I'll ask individually to all the panelists and speakers about my doubts.
Okay. Dr. Isha, your views about this question, how to handle the maternity leaves and the post-maternity retention.
Uh, So I would just like to give an example. So we had a doctor who had joined, very new, and in the joining, she had told us. I mean, not exactly in the joining, but in a month, maybe she told us she's, expecting, and um, uh, yeah, she's expecting maybe in another 3 months, and so our organization at that time, the maternity leave, being a private organization, would it would start applying to a staff who's at least served for a year. So in that scenario, we were a little confused, like how to handle that staff, because she would be on a very higher payroll, and plus she's just served for say 4 months, and she would be going off for probably 6 months. So at that time, we wanted to definitely give her a maternity leave with a pay. So, but she was not coming, she did not serve the organization for a year. At that time, we decided, we'll pay her half the salary, even though she did not complete 1 year. And obviously, it was a good standard employees, but they sometimes don't stay very loyal. At that time, I don't know how to handle that scenario. Like that can be for a doctor, for a clinical, paramedical, any staff, we would want to do great things for them, but many a times we would feel, this did not pan out very well, or yes, this did pan out very well. So I'm not very confident how to handle that scenario.
Thank you, Dr. Isha. Aarti ma'am, over to you for the next panel set of questions.
Yeah, so I'll combine the two questions. I think how to teach non-medical staff who is fresh to ophthalmology regarding OPT and OT management, especially in areas where we can't get the trained staff. And the second part of the question is, are there any proper training SOPs for training of staff for different sections? Like let's say IOL, billing, purchase, stock management. So I think this is a very, very important question, and we should include all the panelists for this. So we'll start with Ramamurthy sir for this.
I think it's extremely important to get good trained staff, and it's oftentimes the kind of nursing staff and others who have done even a BSc nursing and all are not appropriate for us. It's the youngsters who come after 12th class. We ourselves have run a nursing course, so majority of our staff come from that course. And similarly for optical fitters, we have a course. For optometrists, we have a fellowship course. We find that these are people trained in our own environment, in our own, those are the people who fit in best. And usually during the training itself, we have a couple of years of bonding that is also built in so that they serve the organization. And by the time they finish that period, they have reached a salary level, a comfort level, so that most often they stay on. And just in case they get married and want to shift to another sector, hopefully we'll be able to accommodate them in another town if it's in somewhere in South India. So this works very well for us, but I know that this may not be applicable to smaller organizations. So the most important thing is this training will be on-the-job training. It will be the seniors who are there. If you take a girl who is going to be working in the operation theater, especially for cataract surgery, I feel that any bright girl, after 2 months of being in the operation theater, watching and subsequently being mentored by senior theater staff, can start assisting you for the surgery. So it's important to have that kind of a your pipeline full of people like that. And it's important, depending on the size of the organization, you should have them. And it's usually we leave it to the senior receptionist to take on the younger staff to train them. If it's a girl who is going to be assisting in the OPD, we put them under care of somebody who's a senior who can mentor them and teach them. And oftentimes, as students, they've already worked, observed what's going on, so adapt to the situation quite quickly and easily. And these are the people who serve the organization the best.
Gaurav sir, your views on this?
Yeah, so what I feel is that, in fact, some of our best assets are those people who grew with the organization, who joined us maybe after their, class 12 or their graduation, and, who were absorbed into various roles. So what we typically do is when we hire someone who shows promise, we tend to kind of now have almost in every department some trainees. So, for example, right from say an HR department or a biomedical, engineering department, and maybe even in the MRD and the front office. So typically we'll have one or two trainees in each of these and see what kind of potential they have. And then you can kind of, see that, what is their kind of, what are their strong points and what are their interests, and then gradually kind of put them into that. Sometimes, you feel that you hired somebody to work with the front office, but you found that that person was more kind of comfortable in counseling roles, or, in some other role, for example. Then you will kind of, move them to another role. And sometimes they come up and ask you themselves that, we would like to do this, because once they join the hospital, they see what the others are doing. And many of them, would kind of know that they have to, they can move on. So we love to do that. And that, it works really well because these people are otherwise not professionally qualified. So if they were to go somewhere else, they would not, get hired for a particular thing, but they train themselves well. For example, on all our equipments, for example, on a pentacam or maybe on a biometry thing. We do have a lot of people who have grown and learned from their seniors, as Ramamurthy sir said, and they've become really good. And then sometimes you're surprised by how much interest they have, even though I have no ophthalmology background, and even for our clinical assistants and our clinical coordinators. So we typically try to move them between departments and see where they fit in best and allow them to settle in, and then they become very good assets. So I think constant trainees in various departments helps us get there.
Can I make a comment? Yeah.
Sure, ma'am.
Yeah. So basically, what we are practicing is, for example, like you mentioned, somebody who is joined as an OPD or as a receptionist, we usually have a set of SOPs for every department already made that we are following. Okay. So suppose that person is like we are hired for a receptionist. The first week he's basically observing everything, and then they go through the SOPs and they're actually made to read every point of those SOP and explained. And after a week, we need to keep doing these appraisals regarding how they are picking up, whether they are grasping correctly or not. And then we make them actually perform those things in front of us, not directly in front of the patient. Like for example, refraction. So first they will do somebody refract somebody from the hospital itself, so that the patient does not feel that there is some new person who is still learning and I am being made being like a guinea pig. So once that is done, then at the end of 1 month again, and then 3 months, once we are really sure that that person really has picked up well, and then only we, so that at least that training goes on for a month or 2 to 3 months at least. So that way you need to train, and if we feel that that person is not able to pick up for whatever reason, so maybe it is, see, at the end of 1 month, if you have not yourself given the training, you can't expect somebody to be doing well. Many times it happens that if I have not asked, I have not taught that yes, ab karo, and then I expect, ki, why didn't you do such a thing? So we have to first teach that person and then only expect that he will do correctly.
Agreed. Totally agree. Mandar sir, your views on this?
Yeah, I agree with all that was said earlier. I think having a SOP in place is extremely important. It's a roadmap which you are giving to that person as to how to do the work in a proper way. And then you need to see if that person is keen enough to do that job, is interested enough, whether he's observant enough. Because oftentimes, as was said, these people are not from the medical background, you said ophthalmology background. So you need to see their attitude in general. Are they interested in what they are doing? You need to observe the way they come across or they deal with situations. One thing which I have sometimes done, not very routinely, simulate certain situations. So simulate certain difficult situations and see how they react. So even that can perhaps bring out certain important aspects of their behavior, especially with the front office staff. As far as the OT is concerned, I think if you have some senior person in your OT, I delegate responsibility to that person to teach the junior person who is joining new, and ensure that the junior person is learning the right way. But it is ultimately a hand-holding which you need to do, either yourself or your senior staff need to be told that since you are in a leadership role, it is your responsibility to train the junior person. And one more aspect is, oftentimes when a junior person joins, the senior person may sometimes feel threatened that is this person going to replace me eventually. I think that message has to go very clearly to the entire staff that nobody is going to replace you. It is just that person is going to help in doing the work more efficiently.
Dr. Sunandini, would you like to ask next set of questions?
Okay, can I
Yes.
just make a point before we move on?
Yes.
Yeah, I think so. I mirror all the opinions said by the previous panelists around SOPs and training the other staff, learning on the job. This is one thing. I think it's also important to make all the departments know what each other is doing. So what we do is once a week, when we have a downtime, we have a session of 1 hour. Let's say we have a session on OT sterilization and practices. Even the receptionist will actually sit in on it. So I think it's very important to know what the other employees in the staff role is and what exactly they do. so they don't act very disconnected. So even the receptionist must know that if a patient comes in and asks for refractive surgery, eventually they'll have to perform a topography. So even before they come up, the receptionist will take the initiative to say, these tests will have to be performed. You can save time now by getting this test done and paying for it upfront. And then they refer the patient up correctly. They're seen by the correct optometrist and seen by the correct doctor. So I think only when you have such sessions, maybe you can do it once a week or once in a fortnight, and you can let all the other employees know what exactly is going on in the hospital, what the other departments are doing. All of them will work in cohesion as a single organism.
Thank you so much, Dr. Varman. So we'll move on to the next two questions. So I'll club these questions because they are quite similar. So how to deal with a lazy or careless staff, especially in those whom you have took your time to train them, and also how to make sure that they are following the OTA and OPD protocol. And if a staff is not working well and a center has more than 10 staff, then how do you sack this staff who are careless or lazy or not working properly without getting problems with the labor code? So we'll start with Dr. Vibhuti. Are you there?
Yeah. So the question was all fine until until you got the labor department into question. Because yeah, we recently had the similar problem that you said, and probably you might be having one of me as one of the persons who take that question. It's the labor department has made the laws such that it is very labor friendly. So even if you penalize or you do anything to the staff, they will be having a problem and an objection with it if you question them. So I am currently still finding a way how to deal with such staff. What we usually do is we have there has to be a way to penalize the staff if after repeated warnings they are not following your protocols and SOPs. So in tier 2 cities, as Nilesh rightly said, there is a lot of lack of professionalism. You have a lot of laid back staff, so you have to basically sometimes get into their shoes, talk in their language, their tone, try to buck them up, but um, or try to incentivize their work, or try to encourage them non-financially by relaxing their work hours if you think that they may prove to be productive. But if they don't, then as of now the only remedy for me, and that is why I'm still searching for an answer, is to give them a month's notice and remove them.
Yeah, so we do a little bit
Oh,
different. So we give them three warnings, three written warnings, and three of the management staff generally sign these warnings. So this is something that we got to know from the labor code only. So we'll just quickly go through other panelist answers also.
Yeah,
Ramamurthy sir,
please. I'm all
yeah,
ears for them.
I think it's a
your views.
very important question. And of course, the first thing is we try to correct them and retain them within the organization, help them to settle down. If it doesn't work out, then definitely the way we do it is something like along the lines you also mentioned, in the sense that we issue them a written memo, and where we said what is the kind of course, if it's a serious offense like some pilferage or some sexual misconduct or something, no questions asked. It's immediately even reported to the police, file a FIR and throw them out and make them an example for others so that they don't indulge in that. But if it's a kind of a non-performance or underperformance, then you point out that this is what is expected of you and issue a warning letter to them. And just in case, and then it's repeated again, each time you sign, get a copy signed by them. Most often, I find that once this is done, they try to improve and they employ themselves with some encouragement. Further steps are not needed. But if it persists with 1 month notice, you have every right to sack them. You are saying 3 times, but we do it only for 2 times, and then we have not had a problem because of that. Of course, at that time when you are sacking them, make sure that you settle all their dues, whatever PF, ESI contribution, everything that's due to them is paid off upfront, and also get a letter of release from them. And this has worked for us reasonably well.
Thank you, sir. Dr. Handar sir, your views about this question.
Yeah, I agree with what Ramurthy sir said and the other panelists also said. I think we need to make a clear distinction between the kind of offense that was, whether it was the non-performance issue, or whether it was some kind of a misconduct. For misconduct, there is no, you can't pardon them. They just have to be sacked, and of course, the right authorities need to be informed. But for lack of performance, I think you realize over a period of time. So even before it comes to that stage, I think it's a good idea to call the staff, talk to the person, and ask them why they are not able to do their job. Is it something something wrong with the other people that they are working with? Because oftentimes I've realized that there could be some friction between the staff itself, which can trigger this kind of a behavior. So you need to find that out if that is one of the factors which is causing this non-performance. And ultimately, then if the person is not improving, then with a reasonable notice of maybe a month, I think you need to sack that person. But always ensure that everything is in writing. And oftentimes, what I've realized is that this person who leaves your organization can badmouth you when they go to some other organization, especially in the same city or in the same town. And I think that should not happen. So you need to tell them that we are removing you because of your lack of performance. It is not because of our whim. And ultimately, the staff behaves as the leader does. So the team is as good as the captain. So if your behavior is above par, I think most of the times the issues do sorted out.
Thank you so much, sir. And Aarti ma'am, if you can do the closing remarks.
Sorry, let's ask Anaga ma'am if she wants to comment something, and then we'll give vote of thanks.
Yeah, first of all, I would like to thank all the speakers and all our esteemed panelists for sparing your valuable time and being with us here today. And I think 1 or 2 hours is actually too short. There is so much we can talk about and so many experiences that we can share. Probably we can have an entire session on it. But finally, I think we all learn the hard way through our own experience. People are going to be different. What I do may be different from what somebody else does, but human nature is bound to be different and unpredictable. I think HR is one thing which is the most difficult to understand, most difficult to get, most difficult to retain, and most difficult to understand. But still, I think we have managed to give some kind of guidelines to our viewers. So thanks to all our speakers and panelists, thanks to our moderators too, and I think we'll have more and more such topics where we can discuss, and then as a team we can go ahead much better. Thank you.
Actually, ma'am, I like to mention this ma'am when she was going to take over as MOS president during APCRS Ahmedabad, she just told me passing that we want to do a series of webinars and it will be different. So like we come across so many people who want to collaborate and do these kind of webinar, but ma'am is one persistently getting the topics and giving me the theme that this is the theme that this is going to be, and she also finds actually the speakers that are very good for those topics, and the panelists bringing national leaders like Ramamurthy sir, Gaurav sir on the table. So thank you, ma'am. This is really a good learning opportunity for young ophthalmologists as well, because these topics are they come quite late. Even when we start practice, the first focus is to get the skills, and these topics come very late for a private practitioner. But thanks to you, I think we are getting sensitized much earlier. So, and thank you, Ramamurthy sir and Gaurav sir, for joining us, and Mandar sir, Neha ma'am, everybody. Thank you.
It was indeed a pleasure, and I must congratulate both the moderators for bringing out Dr. Aarti and Dr. Sunandini for bringing out so much, good material, and of course all the panelists, and Dr. Anaga for, always persistently doing. She's at it all the time. All your surveys that you've been doing, they're so meaningful, and all the webinars. So I really appreciate how you're able to take out time from your such a busy, schedule with so many centers, and you're still pursuing academics, and and for MOS, you're doing a great job. So congratulations.
Thank you so much. Thank you. Thank you.
Yeah, I really feel that this is a very, very sensitive topic, which is very less discussed. And I think uh, gaining academic knowledge is one aspect, but I think management skills and HR forms a very crucial aspect because we are a service industry. So it forms an extremely crucial aspect of the work that we do or the service that we deliver. So I must congratulate Dr. Anaga, the YOSI team, the moderators, the speakers for a wonderful session. And I'm sure that this is going to benefit all of us. And it was a great learning. And thank you for the opportunity to include me as a panelist in this.
So,
Thank you for the opportunity. Truly enjoyed being a part of this and great learning experience. And congratulations, Anaga and team. I think wish you many more.
Thank you so much.
so thank you,
the
everyone.
everyone.
YOSI
I
team,
think
and I'm sorry, I just
we-
wanted to say that the YOSI team is doing a great job. And we
Yes.
obviously had wonderful speakers today, so I forgot to mention that all the talks were excellent. Thank you.
The discussion was even important, sir. Discussion went on very well. Thank you.
So, thank you so much, everyone. I think vote of thanks is almost done. But at the end, as a formality, I would like to thank each one of you for taking time out. I would like to thank Numerotech for being our technical support for this webinar. And see you soon for episode 5, which will be announced shortly. Thank you, everyone. Have a great night. Bye.
Same to you.
Thank you.
Good night.
Good night. Good night,
Thank you.
everyone.
Good
Thank
night.
you.
Good
So
night.
much.
Thank you
Thank
so
you so
much.
much.
Thank you. Thank you,
Thank you,
Dr.
ma'am.
Nilesh. Also, yes. Thank you, everyone. Bye.
Thank you, ma'am.